Today we will learn about an important topic of abdomen anatomy, rectus sheath. Rectus sheath, it is an aponeurotic sheath enclosing rectus abdominis muscle and pyramidalis muscle. It is an aponeurotic sheath enclosing rectus abdominis muscle and pyramidalis muscle. Now, how is the rectus sheath formed? The number of rectus sheath on each side is 1. There are one on each side. The rectus sheath is 1 on each side. Now, this is a diagram of rectus sheath. Firstly, there is wall of rectus sheath anteriorly, and this is anterior and this is posterior. The anterior wall is completely covered, and posterior wall is deficient, incomplete. Above the costal margin and below arcuate line. Now the composition. Composition anteriorly there is a variable composition and uniform composition in posterior wall. Now extent. Anterior wall extend from costal cartilage to pubic symphysis. Anterior wall extends. Posterior wall extend from lower margin of ribs to the horizontal line passing through anterior superior iliac spine, the arcuate line, from ribs to arcuate line or the arcuate line. Now the muscle forming anterior wall, external oblique, and there is nothing in the posterior wall above the costal margin. Now below the costal margin, internal oblique, and on posterior wall it is internal oblique and transverse abdominis. There is transverse abdominis and external oblique and internal oblique also below the level of arcuate line, and fascia transversalis on posterior wall. Above costal margin, there is anteriorly there is external oblique, and posteriorly no structure above the costal margin, and between the costal margin and arcuate line or the anterior superior iliac spine, there is external oblique, internal oblique, and posteriorly there is transverse abdominis and internal oblique, posterior lamina of internal oblique. Now below arcuate line, anteriorly internal oblique, external oblique and transverse abdominis, and posteriorly there is fascia transversalis. Now the contents. The muscles present in the rectus sheath are rectus abdominis and pyramidalis muscle. Now the arteries are superior epigastric artery, branch of internal thoracic artery, superior epigastric artery, internal thoracic artery की branch, और inferior epigastric artery, branch of external iliac artery. Now the veins are same. Superior epigastric vein drain into internal thoracic vein, and inferior epigastric vein drain into external iliac vein. Now the nerves are lower 5 intercostal nerves and also subcostal nerve. Now the applied anatomy, the last topic. Divarication of recti. In multiparous women and chronic weak children, the upper part of linea alba becomes stretched and gap is produced between two recti. This is divarication of recti. Now second applied anatomy, supraumbilical median incision. What is the advantage of supraumbilical median incision? The advantage is it is bloodless area, hence there is less bleeding during operation. Now the disadvantage, it leaves a big scar after the operation. There is also delay in healing of wound. Now infraumbilical median incision. Infraumbilical median incision. What is the advantage of this? It prevents ventral hernia, the production of any substance, okay, anything. Prevent ventral hernia, infraumbilical median incision. Disadvantage is big scar is formed and delay in healing also of wound because of less blood supply also, and less blood supply. Paramedian incision, the advantage is early healing. This is best. Paramedian incision, there is early healing of wound because of rich blood supply. This is the applied anatomy of rectus sheath, and the last applied anatomy is incisional hernia of rectus sheath.